I would now like to introduce our facilitator, Karen Francis.
Hey, well, good afternoon, everyone, and welcome to what is really the last webinar for the 2012 Rural Behavioral Health Webinar Series. Again, my name is Karen Francis, and I'm a senior researcher here at the American Institute for Research, and I've been working very closely along with some of my other colleagues, Jennifer Kitson from the National Center at EDC, Joyce Sabian and Alison Paxis on the Rural Behavioral Health webinars, as well as some of the activities that we've conducted over the past years as it relates to rural behavioral health. So, well, today's webinar, along with our past webinars, are supported by and represent really a strong collaborative effort between the Child, Adolescent, and Family branch and the Mental Health Promotion branch at the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, along with the Western Interstate Commission on Higher Education, the Mental Health Program. Often we refer to the Western Interstate Commission on Higher Education as WICHE, the National Center for Mental Health Promotion and Youth Violence Prevention, the National Technical Assistance Center for Children's Mental Health at Georgetown University, and then also the Technical Assistance Partnership for Children and Family Mental Health. So to begin our virtual town hall discussion today, I'd like to introduce two of my colleagues who have joined with me this afternoon to assist in facilitating this particular webinar. We first have Jeremy Vogt. He's a Behavioral Health Research and Technical Assistance Associate at WICHE through the Mental Health Program. And Jeremy also serves as the Lead Technical Assistance Specialist working on behalf of WICHE on the Systems of Care Initiative in South Dakota. And we also have joining us this evening, my other colleague is Joyce Sabian. She's a Public Health Advisor at the Mental Health Promotion Branch at the SAMHSA, and through the Division of Prevention, Traumatic Stress, and Special Programs. It's under the U.S. Department of Health and Human Services. So, as I mentioned earlier, our webinar today will take the form of a virtual town hall discussion session. We hope to engage each of you in discussions around sharing ideas, some of your successes and your challenges in shaping the environments and providing programs and services in your rural communities. We'd also like to engage in some conversation around what are some of the trends in overall health that we're seeing within our communities, and then to talk about some topics or areas of focus for the upcoming 2013 Rural Behavioral Health Webinar Series. And then we'd like to also gather some feedback from you participants and from you who are working in the field as it relates to the development of our updated and rural behavioral health website. So with that in mind, I just want again to start off this webinar with a polling question, and just to get a sense of who are the participants on the phone and the geographic locations that you do represent. So on your screens, you will see the first polling question that asks, in what region of the U.S. is your community located? If you would just take some time just to select the region of the country in which that is listed here, and then we can move on. Now, we'll just take a few minutes to do this. So we see that thus far, we have quite a number of our participants with us this afternoon. Over 58% of our participants are from the South and Southwest, with 14% from the West, Northwest, and Mountain States, 14% from the Midwest, and we have 6% from the Northeast, Mid-Atlantic, and then 6% from the Southwest. Alrighty. And then just to move to our second polling question, again, just to give us a sense of who we have on the phone and the role that you do play in your communities. What is your role in your program, our community here? If you just take a few minutes just to give us some responses so we'll have a sense of, some of the roles and responsibilities that you all to take up in your communities? And again, we have 25% of participants on the call this afternoon are, well, actually now 30% are management and administration, have the role of management or administration. We have another 30% that are in the clinicians and service providers, 15% that are federal, state, or local policymakers, 7% that are youth and family representatives, and then we have 7% that are community-based program providers. All right, great. Thank you so much. So, Joyce, I'll turn this over to you to begin the conversation.
And Joyce, please press *7 to unmute your line. Oops, Joyce, are you there? *7.
How's that?
There we go. We got you.
All right, great. So can you hear me okay otherwise?
Yep, you sound good.
Very good. So hello, everybody. It's great to be here and around one of my favorite topics around rural communities and children, youth, and families in those communities. So I wanted to welcome everyone also on behalf of SAMHSA, and I sit in the Mental Health Promotion branch of SAMHSA, which has a number of grant programs that, including Safe Schools, Healthy Students, and Project Launch, and suicide prevention is in our division, and a number of other child trauma and various other programs that are focused on promotion and prevention. I also want to welcome everybody on behalf of the Child, Adolescent, and Family branch. So much has been learned about rural communities in recent years, and the Rural Behavioral Health webinar series has really been an important part of helping raise awareness and attention to the needs of children and families in rural communities. So I'm excited that we can look forward to a 2013 series, and this is an opportunity we're thrilled about to have those of you who've been able to join us on the call today to participate in kind of reflecting back on your own experiences, thinking about what would be helpful in this little niche that is available to us to bring people from all over the country together to talk about the specific and unique needs in rural communities. As Carsey Institute puts it, I like the way they did this, from waving wheat fields to shuttered manufacturing plants, from the majestic Rocky Mountains to the impoverished Mississippi River Delta, rural America is as varied and nuanced as the landscape it inhabits. We've learned that place does matter, and rural America has been changing and continues to change in dramatic ways. The science for determinants of health are helping us understand the links between place and health and mental, emotional, and behavioral health. We've learned that only about 40% of health outcomes are linked to health care. We've also learned a lot about prevention. We've learned about early brain development and all the advancement of prevention science, and what we've learned about evidence-based practices is really informing the work in our communities, states and nationally. We know so much more about what is needed to help young children, youth, and their families thrive. We've learned a lot about what it takes to provide effective and quality services, and yet we have many, many challenges. We understand that poverty is a huge risk factor for mental and substance use disorders, and some of the worst poverty in the country is in our rural communities. We also know that a disproportionate number of very young children under age 5 are living in chronic and extreme poverty. We've learned a lot about disparities impacting behavioral health outcomes. We know that people of color, the LGBT population, and and those living in rural communities, in fact, are at increased risk. We also know that some of these populations have disproportionately higher rates of mental and substance use disorders and are more likely to end up in jail or in the prison systems. Those are just a few of the challenges, and we don't want to forget also that living in a rural community can also bring many, many strengths and protective factors. And so in this series, as we go forward, we also want to look at what are some of those practices that are working well in rural communities, what can we learn from each other, and how can we bring those models to the attention, and what is needed in terms of customizing, what are those elements that are unique to a specific community, and what might be something that can be more generalized. So on the next slide. So we want to get your opinions about what some of those important recommendations are that are going to help support effective practice and service delivery in rural behavioral health. What are some of your opinions in terms of recommendations for policy to support effective practice? And what would be helpful in your community in terms of research, knowledge, technical assistance types of strategies, and how can these webinars be most helpful to you? So I think in this, just for a few minutes, I wanted to open the lines, and I guess that I learned how to do *7, so I just wanted to provide a few of those comments just to kind of stir the water, so to speak, and just have a few comments and questions, and then we'll take a look at some trends and talk a little bit about that. So anybody wanna react or comment, something that we missed and really needs to be in the mix as we think about kind of the variety of issues that are going to be important for us to consider as we look at the resources for rural going forward.
If you'd like to say something, please press *7 on your phone, or you can enter something through the Q&A box, and I can read it out loud.
I noticed that we've got folks from Florida, New York, Pennsylvania, Illinois, Michigan, at least registered here, Texas, Florida, Kansas, Missouri, Ohio, Colorado, California, very different communities, I'm sure, there. So anybody want to jump in, and what's going on in your community? Maybe I'll call on you, Jeremy.
That's fine. I can go ahead and even share some thoughts, just things that I've kind of, been hearing a lot about or coming across, and just in my time kind of getting to work within rural behavioral health. First off, thank you so much for allowing me to be a part of this, and I'm certainly happy to field any questions that anybody might have too about some of the things that I've been involved with. But I think as you were talking about, Joyce, I think there's kind of the three kind of overall factors that just won't seem to go away in terms of improving behavioral health within rural, and I always think about the 3 A's.
Right.
Availability,
my notes, yeah.
Yeah, availability, accessibility, and acceptability. And it's just one of those things where it just seems like, no matter what, there's always going to be this deficit in having enough providers available, transportation issues, people being able to actually reach these services, and then just the general sort of issue of, can we even get people who want or need behavioral health services to actually go and receive them. And so, I think two of the kind of more critical things that I think you're gradually seeing more movements, but there's still significant obstacles in the way. One being integrated care, and then the other is the increasing availability of telehealth services. And I think in a lot of ways they're connected, but even specifically with integrated care, we know that one, they're not by much, but there is a much higher availability of kind of medical, physical health clinics in closer proximity to where people live in rural areas than there are mental health providers. And even if there are mental health providers, located within rural areas, it's just still very difficult to get people to go and access those services if they're concerned at all with their confidentiality, their privacy, and those sorts of things. And we obviously need to continue to recruit more and more community health clinics to, one, want to bring in behavioral health professionals, and then at the same time recruiting behavioral health providers to go out to these rural areas to work in these community health clinics, the federally qualified health centers, those type of places. And I think it will end up being more of a draw, though, to behavioral health providers to go and work, in these, federally qualified health centers, than trying to get them to go out and set up, private practices, because one, there's enough issues with isolation alone, but there's also just, there's just this growing movement towards more collaboration, and we certainly know that, even though our services have tended to be fragmented, people's health is not. We know that the majority of people who have a behavioral health condition tend to have at least one physical health condition. And in the same way, we know that at least 29% of adults who have a physical health condition tend to have a behavioral health condition. So they're very much comorbid conditions and need to be treated that way. So I think you're gonna see more and more providers as they get more kind of knowledge and the benefits of collaborative care and integrated care. I think it's just going to be a really good recruitment tool to get providers to go out and work, because they won't feel so isolated. They'll have a much better chance of getting to get those patients who do need some behavioral health services to actually show up, because they'll be going to the same clinic that they go for all their other services. There's a really great rural family doc out in the state of Colorado who does an interesting talk where he talks about how many pickups in your parking lot, and he flashes up in some rural community in Colorado, he'll flash up a picture of the behavioral health clinic, some private practice clinic, and you look at the parking lot and it's practically empty and there are no pickup trucks. But then you look at, then he shows a picture of, the family doc clinic, the community health center, and it's tons and tons of pickup trucks. So we know that's where people go to get their care, and nobody really has to know why you're going to get your services there. So I think that's a big recruitment tool that needs to be worked on, and just to try and get those providers to get out there, and it just will hopefully help with the availability and the access, and hopefully even acceptability in some ways.
Hey,
and then,
Jeremy?
yes.
We actually, while you've been talking, we've had a couple of questions come in, so if you
Oh,
don't
sure,
mind,
great.
I think I'm going to read those out.
Okay.
The first one is, what is a good resource for getting information on local federally qualified health centers, SQHCs?
Yeah, so there are a few out there. I think one of the first places to start is looking at HRSA, just to kind of get an overview of kind of what are the requirements to become a designated federally qualified health center. And then even within individual states, there are usually some individualized resources for each state in terms of kind of where your FQHCs are located, and again the standards within the state to try and receive those qualifications, or to see if you meet the qualifications. Another thing to certainly look into, if it's something that you're interested in, is there's also lookalikes, which tend to be another useful way of folks trying to kind of get their foot in the door and make the process towards meeting those requirements for federally qualified health centers. Let me look really quick here.
Well, and Jeremy, I don't want to put you on the spot too much, because I think what we want to do is kind of gather some of these topics so that we can, look at what we want to do in 2013 and
sure.
Hopefully maybe follow up on some of these individually if there's something along these lines that we can be helpful with. I was going to also note that, one of the shifts that we're, in terms of service location, is in the school systems, and we have a number of folks who are from education that are on the line, and I think we're seeing, especially with children, that providing services in natural settings is a direction that we're beginning to go. And Pat, I know you're on the line too and might want to say a word or two about that.
Joyce, can I read two more comments? They're not questions, but they're comments, and I think they're really well said, so I'd like to be able to read those out before we move on.
Yep,
so they
go ahead.
Our first one is, in rural North Florida, population scarcity means extremely limited mental health resources to no resources. For children with true mental health issues, services are typically available through school districts. As these children age, law violations are the route to services. This is such an unfortunate avenue to services. So that's our first one. And I'm going to copy all of these and put them into some kind of document so that we have them. And then our last one, along the lines of availability, I believe there's a need for increased frequency of visits with behavioral health providers. Some that access behavioral health care providers may only be able to access them once a month.
And, I think that those are just two very important salient points, as we talk about, Jeremy, as you'd mentioned, and George, you'd mentioned this issue of access and, availability, that, how we look at the development of services within our rural community really does need to be couched in, in a real understanding of what are the access needs and the availability, and as you even said, Jeremy, the acceptability, needs of the populations that we're serving.
And with this in mind, if you don't mind, it might be a good point to move on to our next slide.
Okay, yes, I agree. And I don't know, Pat, I had mentioned your name. Did you want to, because I think it fits within the trends, do you want to just say a couple words about the school services?
Sure. Working in rural Northwest Ohio, we work with 9 local districts, and we have, through Project STATE, school-based mental health counselors. And in the last 4 years, they've served over 400 students that I'm sure would have never received any services had it not been within the school district. And so this is one of the areas that we're really looking at, and our communities are starting to look at. It's a way that it's non-invasive to the parents. They don't have to transport their children anywhere. And it's easier for the parents to give to sign a form that their children can be counseled, because they don't have to do any of the work at that point. And so from that point, we're looking at the possibility, or we're hoping to be able to continue this service, because we're finding it's going to meet with more success and be cost effective in the long run, because if we can reach the children now, our plan is they're not going to need the bigger services later on.
Thank you. Thank you. So, so we're already touching on a number of different trends. I didn't want to let this conversation go without at least referencing the Affordable Care Act. Our administrator, Pam Hyde, was speaking about this today and saying, that we are, now in the throes or in the process of a really fundamental and historic shift along the lines of Social Security when it first started. She talked about that there would be tons of variations by state, and talking about it as a profound change. So this is something that all of us need to become real familiar with. There's shifts in payments, learning about the healthcare exchanges, the various structural changes. There's some unique aspects for rural communities that Jeremy started to touch on there. The notion of and really building upon medical home models. And for children and families, there's real serious exploration of how systems of care, as we have funded it here at SAMHSA, and as a philosophy of an approach, that it is also very much aligned with what we have often called a medical home model. So I think there are leaders out in the world there that are really exploring how that might line up and could be very beneficial both in rural communities and elsewhere. Certainly a lot of work to do, and I think all of us who are involved in rural have a challenge in terms of helping to shape and bring both the big issue of behavioral health, bringing children and families to the forefront, and also what are the implications and needs of rural communities. So there's several layers there that I think we all need to be able to get involved with in terms of helping to shape where this goes. So those were the comments I was going to make in terms of trends. So again, if you want to press *7, we can touch base on this as well as other trends that that the group wants to talk about and make sure that we have for consideration. Please press *7.
We also have a great question for you. It's what assistance do rural communities need to address priority issues?
I would toss that back and say, what assistance do, what kinds of things are those of you on the phone who are in rural communities, what kinds of things come to mind that would be helpful?
I was going to say, Joyce, I just had one thing I wanted to throw in. I think that kind of fits with this is I'd mentioned telehealth, but there's even something a little bit different than that we at WICHE here had come across and are kind of doing a little bit more investigation into, and that's this sort of telephone consultation project that's going on in Massachusetts right now, basically trying to increase access to child psychiatry or child psychiatric services, and it's the type of thing that I think really could be broadened to kind of even including adult psychiatric services, and the basic idea of it is we obviously know that we have a massive shortage of psychiatrists, and in particular child psychiatrists within rural and frontier settings in the country, and of course even if you can get a person into to see a psychiatrist, it can still be 3 to 4 weeks maybe at a time, and getting back to this idea of even kind of having this healthcare home, it seems sort of silly when you have a patient who actually somehow managed to make it to the primary care clinic that day despite all the other issues that are probably going on in that person's life or that child's life, and you have them there right now, but it's a kind of a situation that might be a little bit beyond the comfort level or competency of a rural primary care provider, and they just are in need of being able to consult with a psychiatrist just to sort of help this person get on some medication. And I mean, what would be, better than being able to contact, a consultation service where you can talk to an expert in psychopharmacology and get some really important, consulting advice on how you can help best treat this patient. And I mean, I think it's the type of thing that is very applicable to so many different settings. In the state of Alaska, even we're also aware of some of the problems in terms of some of the more northern territories of the state, in which if you have some patients who might even be in need of hospitalization, it's just almost impossible to try and get these individuals to a state hospital, because if they're on islands, for example, how can you really get this person on a plane and fly them to the state hospital or something like that? And so is there a way to manage these individuals without having to move them, but you obviously need to have that resource. And so there's just so much more, I think, that can be done in terms of just using this technology that we have right now to connect folks better, so that it doesn't necessarily have to be about physically locating these people in these shortage areas, as long as we can somehow get access to them. But I think there's going to have to be a lot of work in state laws, in particular, in the next year or two, to kind of remove some barriers, such as licensure requirements. So you have to be licensed within that state in order to provide consultation. That causes a problem, as well as some different insurance concerns.
Right.
Hey, Jeremy, that actually plays into a comment that we have. We have a couple that I'd like to be able to read out.
Wonderful.
Incentives at the state level to develop rural behavioral health service capacity and telehealth. We also have regular parent training, so series of trainings for parents. And then also there are needs for additional providers to accept Medicaid and offer psychiatric, psychosexual, and family services, just to name a few. So these are all great suggestions, and I'm taking them all down.
Wonderful.
Yeah, those are all great points and great suggestions. One that I've observed hasn't been mentioned yet that really applies to the telehealth area is trauma-informed care and trauma supports and services. We learned about a great model out of Dartmouth, I think, in New Hampshire, at the Rural Symposium a couple years back, that really was helping to build capacity through the telehealth system, where folks could be identified, where services could be accessed, and largely an array of different services and supports offered through their technology strategies.
Just real quick to add on to the parent training comments, they added on to it saying that for parents in rural communities, addressing parenting skills, fears of medication, what is ADHD, ADD, and also oppositional defiant disorder. So thank you for the specification.
Yeah, I totally agree with the parent training concept. I think actually in general, another thing that could be really helpful for rural primary care providers is even just some increased training. I don't know that there is even the time or resources to do it within their medical school education or graduate school education, but just some more training on kind of behavioral health kind of interventions for these primary care providers, in terms of just not kind of increasing their toolbox in some ways, and not only having medication as kind of their tools, because I think especially there's been some pretty great research done on looking at outcomes with parent training for children who end up getting diagnosed with ADHD. that if you actually have the parent go through some behavioral modification training within the first 3-4 weeks of the diagnosis, and then you end up starting the medication, there ends up being a lot better outcomes because, one, the parents are learning those skills without the benefit of the medication, and then by the time the medication starts, it seems easy then to do the behavioral modification. But if you try and do them simultaneously, it can end up being the parent will end up kind of relying more on the medication and not putting as much time or effort into the behavioral piece of it all. And again, those are, of course, getting into things that sort of go beyond rural, but I think just in general, I think there's a lot of things that could be done, on kind of the rural side in terms of if we can't actually have behavioral health providers always available, can we make the people who are providing care, even better to provide those kinds of services?
Right. And there's the model, whether it's rural or other, it doesn't have to be unique. Some excellent programs like Triple P that are available and can be implemented in various settings that and are kind of use the pyramid model in terms of reaching different populations in need of parenting skills. The Bright Futures is a great resource that's been developed through American Academy of Pediatrics and has been used in rural settings with success. So I think there's various models out there. So, Jeremy, I think we're kind of moving into the next slide already.
Oh, hey, Joyce, we have one question. I just wanted to read it out. It's a question, but I think it's just good to keep in our notes, not necessarily to answer right now. And that is, we need prevention and early intervention services for children who have a parent with a mental illness, also with substance abuse, or both. So I'm going to copy that down. And our last comment is that behavior analysts from a school district could certainly collaborate in developing a training that assists parents in assessment of their child's behaviors. So I'm going to get all of these down, and then I think it's about time to start to move on, which is what I think you were doing, Joyce.
Yep. To the next slide, I'd say. And we can keep the phone lines open, I think, soon. Jeremy, if you want to highlight some of these in 2012, the topics that we cover. Or is that you, Karen?
Yes. So just moving us along here right now, just a refresher. Over the past year, in this year, 2012, we've had 3 significant webinar presentations. And just to recap them really quickly, because what we'd like to be able to do is to get to the point of having some discussion with with you all about what are some of the topical areas or areas of focus that we should think of for planning the 2013 webinar series. So back in 2012, in April, we had a webinar that was focused on trauma-informed approaches to healing for children and families in rural communities. And this is where we had a number of experts from our system of care communities discuss, the concept of what is trauma-informed care, why is it important, and they also provided some strategies for the effective implementation of trauma-informed approaches within rural settings and working with rural communities, rural children and families. And then in June, we then had a presentation on the Affordable Care Act, where there were discussions provided around considerations for school behavioral health programs in rural communities. So really talking about the intersection of the Affordable Care Act, rural behavioral health, and school behavioral health. And then back in September, we then focused our webinar on the issue of improving law enforcement officers' responses to children and youth that have behavioral health needs. That we often know that within the rural communities, a lot of the time first responders to behavioral health crises or behavioral health situations are law enforcement officers. So we thought it would be a good idea to have a webinar that would focus on effective strategies for engaging law enforcement officers and partnering with law enforcement officers within rural communities as they, work with children and family and, inevitably respond to some of the behavioral health crises or behavioral health needs that exist. So those were a general sense of what some of our topical areas were for 2012. So I'd like to turn our attention to talking a bit about, what it is that we'd like to see our webinars focusing on for 2013. And before we do that, we'd just like to get a sense of how many of you on the phone have had any exposure or participated in any of the rural behavioral health webinars. So if you just take a few minutes to record your responses here, and then we can move on. So that we see that 75%, 80%, those on the phone are now we're going, I'll just give a few more minutes before I do the tallies, right?
And even though we only had 3 listed before, I put 4 as an option just because we have had them before, not just the past 12 months.
Right. So. Yeah. So because generally this webinar series we've had since 2009, we've been fortunate enough to offer these webinars over since 2009. And a lot of the focus and themes of these webinars do come from the field. So we're trying really to respond to the needs of the field as a way of guiding the focus areas for these webinars. So we see here that about 53% of those on the phone this afternoon have never been on our rural behavioral health webinar. So we'd like to take this opportunity to invite you to participate in the upcoming 2013 series. And so please feel free to, give us some suggestions as to what some of those webinar topics you'd like to see. We have 7% said that they've participated in one, and 7% also participated in 2. We have 23% that participated in 3 webinars, and about 7% that participated in 4 webinars. So once again, thank you for those. And again, for those of you who participated in one or none of our webinars, again, we'd like to invite you to become a more frequent participant for us as we go through to develop the focus areas for the 2013 webinar series. So Jeremy, I'll turn this over to you so that for the next slide, just so as we can get some suggestions for our 2013 webinar series.
Sure, sounds good. First off, I think it's great to have so many people, being a part of this webinar series for the first time today, and hopefully we'll see you in the ones for 2013. Basically, what I like to try and facilitate here is just to see if there are some topics that come to mind that would be good for our upcoming 2013 webinar series. Looking over the different topics, you can look at different types of content areas, the format, if there's any kind of speakers or other types of community presenters that you'd like to see, any kind of programs that are going on within your community or nationally that you think would be good to showcase. If people have any kind of thoughts or suggestions, they can certainly send a comment to Allie, or certainly press *7 if you would like to voice your opinion as well at this time.
Jeremy, this is Karen. As we were talking earlier about some of the trends or emerging trends that we're seeing in rural communities, one thing that came to mind for me was just this whole overall discussion around, the demographic changes that we are seeing in rural communities, and, the increasing immigrant population that we're seeing within rural communities. And so I was just thinking along the lines of, how do we have discussions and, or, provide some kind of feedback or resources to our communities around addressing the needs of immigrant populations within rural communities, identifying what those behavioral health needs may be like, and preparing to provide a level of services for the increasing immigrant population. So I just thought of that as one, of these trends that have an impact on rural communities.
Absolutely, yeah, that sounds like a really great topic. We know that there is one of the biggest influx in populations to rural communities tends to be immigrant populations at this time. So I think it's only going to continue to be a bigger need of knowing how to help this population. So that sounds like a good one to me. Allie, are there any suggestions that are coming in on your end?
Give me one moment. But I think where did it go?
And just bear with us here, okay?
Oh, here we go. We have one that feature Triple P and other programs that work well in rural communities. I'm unfamiliar with that.
Okay.
Now, if someone could clarify what the Triple P is.
Yeah. Hold on. Am I still unmuted?
No, we can hear you, Joy.
Yeah. This Triple P is an evidence-based parenting program that it was mentioned in the Institute of Medicine report on preventing mental, emotional, and behavioral health disorders, and it has been used in a lot of different settings and kinds of communities. So I'm trying to think. Allie, can we send out a link to that through our?
Yes, you can. I can put whatever it is that you'd like in the follow-up email to this webinar, which will be going out either tomorrow or the next day.
Okay, so we'll provide additional information so you can look into that. I was going to say with the immigrant communities too, we often see one of the demographic changes, at least in parts of rural America, are those populations have increased exposure to traumatic events, often coming from war zones or just in their own experiences. So I think that's an area especially that we need to provide resources to those communities.
Okay. Just in the interest of time here, just moving us along, and Joyce, you had just asked that, we do send out a link to the IOM report for further information about the Triple P program, which then brings, I think is a nice segue into the Rural Behavioral Health website and, the provision of resources and information to the field on that particular website, because information such as what you've just spoken about, Joyce, is where, is a good place for the website is really a good place for us to be able to house that type of information so that, everyone in the field has wide access to that information. So I just like in the few remaining minutes that we do have on the webinar this afternoon, Allie and myself would just like to share with you and to get your feedback on the modified, I should say, Rural Behavioral Health website. We have been operating a Rural Behavioral Health website through EDC for a number of years, and so we're now in the process of transferring that website from EDC to the American Institute for Research. And as we're doing this transfer, we wanted to take this opportunity to also, upgrade and update the website. So your feedback around this website and what we should include or not include in there, what is it that as the end user you would like to see, included in this website? We'd love to be able to get some of your feedback from that. So what we want to do today is and Allie will walk us through this really quickly, just to showcase to you a couple of the pages of this new website that has not yet been launched, but we are hoping to have it launched by no later than February. of 2013, and the launch date, we will make a big deal about launching this web site so that everyone will be able to know that it is available for accessing resources and information. So, Ali, if you could just take us quickly through what are some of the plans for this updated website, please.
Sure, no problem. So, everyone, what you're looking at right now on the slide is actually what we call a mock-up. So, this is not anything that's been published yet. It's not on the web. So, we're still playing around with it, but this is the basic structure. So, these are colors we're thinking of, and the tabs that we're going to have, the home, which will just be about us, is like maybe new announcements, things going on. So the announcement bar that you see on the right-hand side, we'd be able to update that frequently with new things going on, events, conferences, anything being published, so things like that. And then we also have webinars where we would put our newest ones and then also our archived ones from all the years past, which are currently being housed at the TA Partnership website. They will still be there, but it's great to be able to have them all in one area. And then we also have products, which will include, publications or things that we find will be, helpful for you, things that we put out through this series. And then we also have resources, which will be external sites, external resources, organizations that are also a part of this. So having your input as to what could be helpful, what kind of toolkits are you looking for? Are there papers? Is it maybe you're looking for the most recent article that's been published on something with rural behavioral health? And then lastly, we have events, and then also our contact us tab. I don't have the picture of that just yet, but it looks very familiar to this page. So it's pretty simple, but we want to make sure that we're getting all the information to you as easily as possible.
And just for those of you who would like to provide us with some feedback or input on the development of this website, at the end of the webinar, we have our email addresses and contact information that we can make available to you. So, even after this webinar is completed and you have a chance to kind of think about the website and think about what some of your needs for resources or information are, please feel free to just send us an email with some of that so that we'll be able to, have it for consideration as we continue to build this website in preparation for its February launch. And then, Jeremy, speaking of, additional resources and information, Jeremy, why don't we turn it over to you to talk a bit about some of the resources that are currently available through NARM and WICHE?
Sure, yes. So on the slide, we have listed two different resources. The top one is NARM, which is a professional organization, the National Association for Rural Mental Health, and this is the only national association specifically focused on rural mental health that focuses on the entire spectrum of mental health professionals and communities. So, basically it's not unique to just, psychologists or social workers or any kind of healthcare providers. Everybody's is allowed to be a part of this, and just a really great organization to be a part of if you're very passionate about rural health care and rural behavioral health. So we listed the web link to NARM's webpage if you're interested in checking that out, and also if you're looking for a rural conference to attend, the next meeting for NARM is going to be July 31st through August 3rd, this upcoming summer in San Antonio, Texas. Certainly check that out and see if that might be something that would appeal to you. And then also for a print resource, there is also the Journal of Rural Mental Health, which is the official journal of NARM. Certainly, it's a really nice resource if you want to keep up on research that is all very specific to rural mental health and behavioral health care. It talks into working with communities, even gets into some specifics in terms of different types of practice, strategies, those kind of things. It's actually currently undergoing a transformation into being an APA journal. So that's kind of a cool thing that's happening right now. And we put a link then to APA's website, which is the American Psychological Association. And there's a web page on their site specific for the Journal of Rural Mental Health. So definitely check that out and see if that would be something that could be a helpful resource for you.
And we are now just about a minute or two left, so if you have any final comments, now's the time. Star 7 on your phone, or you can submit something through the Q&A box. And if not, we can just kind of move on through to the evaluation page.
Well, I'd like to ask folks if there are any other areas that haven't been touched on, if there are resources that you're familiar with that you think ought to be shared either on the webinar, that we invite you to share those with us. And I think you've got all our emails, and please feel free to reach out to any of us. I see Allie, thanks for putting that up there. So this would be, feel free to contact us, share your ideas, goes beyond the conversation today, and think about the whole range. Again, we've got a great collaboration here within SAMHSA between the branches. We can bring in substance abuse prevention topics as well. Even though we're talking a little more about mental health today, we are focused on behavioral health. So there's a whole array of things that we want to try to facilitate and respond to what will be helpful to you. And I see you've got the evaluation up there, Allie.
Yep, so this is evaluation. If you can fill it out now, that would be really great, but the link will also be provided in the follow-up email that you will receive in a day or two. You can do that there then. And we do not have any comments.
Anyone on the phone want to say anything? It's always tough on the phone, but hopefully this has been helpful, and feel free again to follow up with us. Thank you for all your suggestions too.